My name is Karin Tran Lundmark. I'm a cardiologist at Paediatric Heart Center at Skåne University Hospital. And my main clinical focus is severe heart failure and transplantation, and I also see patients with pulmonary hypertension. And pulmonary hypertension means high blood pressure in the lung. This is sadly often a lethal condition. Currently, we can reduce symptoms and prolong survival, but there is no cure. And this is sometimes very difficult to talk about with my patients. In pulmonary hypertension, many of the blood vessels in the lung are completely blocked with mainly extracellular matrix. And what if we could dissolve these blockages and restore the normal blood flow in the lung? One of the groups of molecules that we're interested in are proteoglycans. You can see them in bright blue in this image. We currently run our experiments at the Tomcat beamline at the Swiss Light Source in Switzerland, but our hope is that MAX4, the synchrotron in Lund, will have similar equipment in a few years' time, and this would facilitate our work a lot. I hope that I will be able to tell my patient at some point in my career that we have a curative therapy.